as we go through this difficult process. Now we'll turn it over to Dr. Farley for his update.
Thank you very much, Mayor. We are seeing continued progress against the coronavirus epidemic with improving signs locally, regionally, and nationally. Here are the numbers. Since this time yesterday, we identified 88 new cases of coronavirus infection in Philadelphia residents, bringing us to a total since the beginning of the epidemic of 33,343 cases. Now, that 88 represents fewer than 3% of the nearly 3,200 test results that we received today. And that 3% is a lower percentage than what we've seen in the past. And now we're getting consistently fewer than 100 cases per day reported to us. Now, with the fall in cases, we are not seeing so much the predominance of younger people that we saw a few weeks ago. Today, 42% of the cases that came to us were under the age of 40, whereas a couple of weeks ago, that was consistently greater than 50%. We have 0 new deaths to report today from yesterday. Our total since the beginning of the epidemic is 1,749. Now, our data from deaths often comes in batches. And yesterday, we learned of 13 additional deaths over the previous 2 to 3 weeks. And there's often a delay before we get the results on that. Over the first 2 weeks in August, we've averaged about 15 deaths per week, which is higher than the 8 deaths per week we had in July. And that's probably a delayed effect of the increase in cases that occurred in July. We did have an increase in cases. There's often a delay between when people have a diagnosis and when they ultimately die from this infection. We don't like the idea that the number of deaths has increased at all. However, to put that in perspective, that's still far below the peak that we saw in April when we had nearly 250 deaths per week. That's what's happening in Philadelphia, and in Pennsylvania and New Jersey, case rates are also falling. In the United States as a whole, case rates are continuing to fall. They've fallen about 20% over the past 2 weeks. Now also the number of deaths per day is falling at the national level. All those signs are going in the right direction. A couple of words on testing. As you may have heard, the CDC recently changed its recommendations regarding testing for people exposed to COVID. And I just want to be clear, here in Philadelphia, we are not changing our recommendations, which are anyone should be tested if, number one, they have symptoms of COVID, which would be like a new onset of cough, shortness of breath, or other respiratory symptoms, or number two, they've been exposed to someone with COVID, even if they have no symptoms. Now, if people are exposed to COVID, we are recommending that they wait 7 days after the exposure to ensure that the test gives you an accurate result. Before then, you might have a false negative result. But it's particularly important for people who have been exposed to be tested. As the case rates go down, testing for those people who are exposed is even more important because we want to identify as many people with the infection as possible so that we can do contact tracing and stop the chain of transmission. Now in the city, we're doing about 3,000 tests per day. I just want to remind people that our goal is ultimately to get to 5,000 tests per day. So we want to increase testing, not decrease testing. For those people who are interested in testing, I just want to remind you that we have a great map that lets you know where you can get it done. We need to update and improve that map. It's at www.phila.gov/testing. A couple of words on contact tracing. We're still working on improving our program for that. The measures we have for the progress last week is very similar to the week before. That week we had 675 cases that came through that were referred for contact tracing. Of those, 30 were managed by other partner organizations. Of the remaining 645, 68% of those we reached, and they agreed to participate in contact tracing. 22% we were unable to reach. And of those that named contacts we were able to reach and persuade to go into quarantine, 72% of those. Then a couple words on reopening. We're still on track to what we announced last week, that effective Tuesday, September 8th, the day after Labor Day, we will allow indoor dining to begin at restaurants with restrictions and theaters to begin. Now, we've had some questions about other sorts of services and other sorts of venues. I want to be clear that a restaurant can operate and provide food without entertainment, or a theater can provide entertainment but no food or drink. You can't do both. Indoor gatherings are still capped at 25 persons, and outdoor gatherings are still capped at 50 persons. Also on reopening, just want to remind people that college students are returning to Philadelphia now for those schools that are open. All the colleges in the city we worked with over the summer, they all have safety standards for what's happening on campus, and they're working with the students on preventing high-risk gatherings off campus. So far, we've had no COVID clusters in colleges, but we're going to stay in close contact with the colleges and watch this very closely. Then I want to just remind people that most respiratory viruses do get worse in the late fall and winter. So whereas all the numbers are going in the right direction right now, and we're very pleased to see that, it is quite possible that things could get worse in the future despite all the work that we're doing. I want to put everyone on notice that if that's the case, that we may have more restrictions that we put in place as the season changes. And then I want to remind people that what we're learning from our interviews with cases when we do contact tracing is that people very often know exactly how they got exposed. Almost a half knew the person that they believe exposed them, and they typically were household members or relatives or friends that they got together with in social gatherings. So the message for people is if you get together with people outside your household, even if it's your relatives and friends, wear a mask. That's a high-risk situation. More information on all this is on our website, www.phila.gov/COVID. Thanks.
Hey, thanks. So, Dr. Farley, when you say you're putting people on notice that restrictions could be put back in place in the fall if the situation changes, but have you ruled out, or has the administration ruled out, like the full lockdown measures that were imposed earlier during the pandemic?
I wouldn't rule out anything. We really don't know what this virus is going to do when we get to the late fall and winter. It's such a new virus that it would really be the first winter it's seen in the United States. We certainly wouldn't want to go to a full lockdown, but anything is possible.
Right. And when do you think a potential third wave could arrive? Is it just the advent of colder weather or any other conditions?
Yeah, so when the weather gets cold, it also makes it the air is dry, and in dry air, it's easier for these respiratory droplets to linger and to transmit from one person to another. I can tell you that other respiratory viruses start to increase in September, and that they peak around January and February. So we could see the effect of this on this virus at any time or not at all.
And then I think this is COVID related. Can I ask a question about the food, the grab and go meals?
The question is for Dr. Farley. Dr. Farley, the question is, we would like to know how the process of tracing contacts and access to testing is working out for Hispanics.
So we are trying to increase access to testing. With that Hispanic group is the one population that we feel has not had enough testing. And so we are providing funding to organizations that provide testing sites, and we're directing more of them in the areas of the community, areas of the city where we have more Hispanic populations. As far as contact tracing goes, we have 5 separate teams. One entire team is a Spanish-speaking team so that they can deal very comfortably with people who are Spanish-speaking.
Then I just wanted to circle back with Dr. Farley on these masks that are cool, but not very, thick. Like they're you can see light through them and everything. And I know you said earlier via email that you didn't expect very many people to use them, but I'm kind of wondering, like, should we just consider them a souvenir? Like if I go out, I have a couple that I was going to give to people, but should I not give them to people?
No, I'm not sure which one you have, and I'm not sure if they vary, but the one that I have is a 2-ply. And so I feel like it's dense enough that this would be adequate. It stays on you. It needs to have a good seal around the nose and under the chin. If yours is different, let me know, but all the ones that I've seen now are 2-ply.
It is 2-ply, but like one of the days you said, if you can hold it up to the light and you can see your hand through it, like which you definitely can with these.
Yeah, no, I mean, to be clear, that test wasn't just could you see anything through it, but really, if you look at say a mesh, some of the mesh gaiters, which is what that study raised questions about, you can actually see holes in the fabric and see the fibers between them. And mine, I can't see that. So
okay.
If yours is different, let me know.
Well, it's a nice souvenir either way. So thank you.